Hello, everyone, and thank you for checking us out for another episode of SAC Health Answers. This is where we at SAC Health take your questions regarding health, and we help to give you some answers that you can use to make positive changes that impact your health and wellness. I'm Dr. Jason Lohr. Many of you may know me as the CEO here at SAC Health, but I'm also a practicing family medicine physician. Today, I have a question from Kent, and Kent asks, what is it about cholesterol? How do I know if my cholesterol is high versus low? What's the difference between good cholesterol and bad cholesterol? What is all this cholesterol talk all about? Well, Kent, that's a very good question and very, very common. In fact, a lot of people in this country are dealing with high cholesterol. In fact, millions and millions of people are even taking cholesterol-lowering medications that have become very, very common. And we see that now across the board, a lot of people on these medications. But there's something important to know about cholesterol. There is actually a good cholesterol. And many people think that's an oxymoron. You can't have cholesterol and good in the same sentence, but it's not true. There is a good cholesterol, and then there's definitely a bad cholesterol. So let's talk a little bit about that. The good cholesterol, we'll start with, is called the HDL. That's the high density lipoprotein. HDL is a good cholesterol. And the higher that we have that number, the better, right? Again, it's very counterintuitive, but the higher we have the good cholesterol, the better. It actually protects us from heart disease if you have a high good cholesterol. Now, the bad cholesterol, which is what most people typically talk about when they refer to cholesterol, is called the LDL, or low density lipoprotein. And that is a bad cholesterol. And the higher that one is, the worse it is for the health, and the more increased chance of heart disease or other issues with your health. So when we look at treatment options for a patient, we have to look at both. We have to look at both the good and the bad, because it really is that ratio and it really is that combination that helps to decide whether or not someone needs treatment. Also, very important to look at other risk factors. If someone just has a slightly elevated cholesterol, and we define that usually by a range of over 180 or over 200 in the LDL or the bad cholesterol, if somebody has that higher level, we have to have that discussion with them. What other risk factors do they have? Do they have underlying diabetes? Do they have high blood pressure? Have they already had some issues with their heart? Do they already have known heart disease? Then they may need a medication, because we need to be a little more aggressive. They already have some other illnesses going on. But if they're healthy otherwise and young, then they may not need treatment, and we can just focus on other things, like maybe lifestyle versus actually taking a medication. So regardless, it is very individualistic. Every patient's very important, and you need to individually see your doctor, your primary care doctor, who is your partner in health, and they can make a decision together with you on what the best treatment plan for you is. So I would encourage you to connect with your primary care doctor if you have any questions about your cholesterol, or to even get your cholesterol checked, which we recommend, by the way, at least once every year that you get your cholesterol checked, so we have a baseline. Thank you for joining us for this episode of SAC Health Answers, and hope to see you next time. Take care.